Hi, good evening. My name is Mariska Brinkley, and today I'm going to be talking about responding to the mental health needs of students. One of the things I would like to talk about is creating a comprehensive mental health program in a school setting. One of the things that is currently in place is education-related mental health services, which replaced 26.5 in which the county was responsible for providing students with mental health services. So, a lot of people think that schools are just responsible to provide students with learning, but as research and studies suggest, there is an alarming increase of students with mental health needs ranging from severe emotional disturbances, children that have a dual diagnosis that can impact their learning, as well as the school climate. A lot of issues surrounding bullying has been on the rise, and one of the things that will help students have a positive school climate is to address the mental health needs of students and to develop a comprehensive mental health program. Okay, so responding to the need for a comprehensive, coordinated mental health programs begins with strong leadership. So you have to have strong leadership in place in order to provide students with the mental health needs. A lot of students are being placed in non-public schools because they are not able to access the curriculum or to be able to cope with the social and academic demands in a public school setting. So what is currently taking place in the state of California is you're getting a lot of students who are being assessed if they qualify for special education services under emotional disturbance or other health impairment, autism, specific learning disability, speech and language impairment, and intellectual disabilities. So you have all these range of disabilities. But the primary focus of this video is to speak on the needs of mental health services within the school population. And my reason for saying this is that a lot of times schools are able to discover if a child has a severe emotional disturbance or mental health issues, and with that the school can also provide that support as well. So having a comprehensive program relies strongly on leadership. That includes the administrator, school districts, program specialists, all those players come together and create opportunities for students to address their mental health needs in a school setting. Principals and central school administrators should publicly acknowledge and promote school climates that support positive mental health and take steps to demonstrate that support. So that is creating a sound mental health program. Okay, so step one, build the capacity of staff members to respond to the mental health needs of students. If staff is not aware of the current issues or what's going on with the student or the whole mental health initiative within the state of California, they're not going to be able to respond and get the needs of the students met in an appropriate fashion, because they're not able to recognize the signs and symptoms of depression or suicidal ideation or any type of mood disorder. Okay. Step two is to hire adequate mental health staff that may include psychiatrists, school psychologists, and marriage and family therapists, school counselors, those who are significantly trained in the mental health area to help students and staff to recognize, okay, this student is having some symptoms of depression, we need to look into that. So having the adequate staff in place to develop a comprehensive mental health program is an important step as well. Step 3, promote a continuum of services that includes school-wide mental health prevention programming and intensive interventions. That is so important. Currently, school districts are referring to a tiered model where there's 3 tiers of services that are provided to students. Tier 1 is the universal supports, where all students, regardless if they have mental health needs or if they're on the spectrum or have an intellectual disability, they're all getting the services. And that could be positive behavior interventions and supports, PBIS, character development, using an evidence-based curriculum to provide social emotional learning for the students school-wide. So that means regardless, all students get these services. Okay. And with tier 2, it's you're providing services to your at-risk students. So that could be someone who is being bullied or being a bully, someone who is dependent on alcohol and drugs, someone who might have suicidal ideations, a student who may be at risk of dropping out, a student who is an adolescent who is pregnant. So all the social issues that are in school, the students who are at risk gets these services, and these services are not limited to individual or group therapy. Linkage to resources and services for their family. There could be students who are homeless, or students who are, witnessing domestic violence, or mom is working 14 hours a day just to keep the lights on. So you have all these services in place and resources to provide to the family because they may not be able to have access to them. Okay? And the tier 3 is for our students who have severe social, emotional, and behavioral problems. These are our absolute students who just cannot access the curriculum. Their conduct disorder, oppositional defiant disorder, mood disorder, maybe low functioning autism, and maybe acting out in aggression. So you provide intensive services, psychiatric consultations, medication management, individual group therapy, aggression replacement training, all type of intensive services should be applied to our tier 3 students. And then create opportunities to regularly assess the mental health needs of students and the effectiveness of school-based servicing. Accessing the mental health needs of students involve both informal and formal methods. That could be an informal method could be check in, check out. A lot of schools are using, especially the tiered students, tier 3 students, check in with someone every day, ask them how they're doing, if they need anything, so that student can feel supported. A formal method is to use some type of data collection. So if you're in a school where there's a lot of problematic behaviors, you can track those behaviors using DD-Track or whatever behavioral tracking program is available to the school. A lot of schools are developing a lot of mental health programs and interventions for students in place. So that concludes this video. I will be sending a PowerPoint, and it was actually fun. Thank you.